Hi, thank you for joining Congresswoman Catherine Clark's Tele-Town Hall, focused on the rollout of COVID-19 vaccines in Massachusetts. We are grateful for your time, and we're eager to answer your questions. My name is Kelsey, and I'm the District Director for Congresswoman Clark. I want to start by saying our team is here to help you. While our office may be physically closed, we are available to answer your questions and hear your concerns. The best ways to contact us are by calling our office at 617-354-0292 or contacting us through our website, www.catherineclark.house.gov. If we don't get to your question tonight, I encourage you to contact us independently, and we'll get back to you as soon as we can. If you do have a question during this event, please press 0 on your keypad, and a member of our team will put you into the queue. While we wait for more participants to get on the line, here are some helpful resources here in Massachusetts. To get up-to-date alerts sent directly to your phone, please text COVID-MA to 888-777. You can also call the informational and referral hotline at 211. For the latest updates on the phased rollout of vaccines in Massachusetts, you can visit mass.gov/COVID-19 vaccines. And if you have specific questions related to vaccine distribution or where you fit into the phased rollout, you can email those questions to COVID-19-vaccine-plan-ma@mass.gov. Again, if you have a question at any point during this event, please press 0 on your keypad, and a member of our team will put you into the queue. And now I would like to turn the call over to Congresswoman Clark.
Thank you very much, Kelsey, and good evening. This is Congresswoman Catherine Clark. Thank you for joining tonight's Tele-Town Hall. I know so many in our communities are suffering right now. The loss of life and livelihood over the past 10 months as a result of this pandemic has been devastating. And I want you to know that we hear you, we see you, and I am working to bring relief and resources to the 5th District so that we can crush this virus and move toward an economic recovery that is robust and inclusive for all. It is undeniably exciting to finally see the first vaccines being approved by the FDA, distributed to states, and administered to frontline workers. And it is an especially proud moment for Massachusetts, as our own Moderna is one of the first vaccines to be approved for distribution. But as President-elect Biden says, it is one thing to have a vaccine, it's another thing entirely to have vaccinations. The federal government needs to provide the financial assistance to local and state governments to support the equitable distribution of a vaccine that is costly and logistically challenging at a time when city and state budgets are stretched thin. At the end of last year, Congress did pass an emergency COVID relief bill that included $69 billion for testing, tracing, and vaccine distribution. But this is just a down payment. We are looking forward to working with the Biden-Harris administration to implement a coordinated national strategy to crush this virus and make sure vaccines are available to everyone as quickly as possible. Now, I want to introduce two important experts that we have with us on the call to help answer your questions about the development and distribution of COVID-19 vaccines. First, I'd like to introduce Dr. Asad Saya. Dr. Saya is the CEO of Cambridge Health Alliance, a vibrant, innovative health system that is committed to serving all those in need. Throughout his tenure at CHA, Dr. Saya has spearheaded efforts to improve the quality, efficiency, and accessibility of healthcare services for many of the most vulnerable in our communities. Prior to joining CHA, he held leadership roles at several area hospitals, including Director of Emergency Medical Services for Brigham and Women's Hospital, Associate Chief of the Department of Emergency Medicine at St. Elizabeth's Medical Center, and Chairman of the Department of Emergency Medicine at Caritas Good Samaritan Medical Center. I'd like to welcome Dr. Saya to offer some brief opening remarks, and thank you, Doctor, for joining us tonight.
Good evening, Congresswoman Clark, and thank you very much for getting us together this evening. And I want to thank you for all your effort and work in advocating for all of us in Washington, D.C. Many thanks to your staff and everybody that's been involved in arranging this call tonight. It is my pleasure and honor in joining you tonight and joining a longtime friend, Juliette Kaim, in really giving some very essential and critical information to the community. It is very important that all of us are involved in providing the community with as much information as possible and easing up a lot of the misunderstandings out there regarding the vaccine and straightening out the record about how important this is. Let me share with you our experience at the Cambridge Health Alliance and my experience working very closely with the state and the Department of Public Health throughout this ordeal starting almost a year ago. We have vaccine on hand at the hospital. We were one of the first organizations to receive vaccine from the Department of Public Health and from the state. So far, we have vaccinated slightly over 3,000 of our 5,400 employees with the first vaccine, and of those slightly over 3,000, about 1,200 have received a second dose. It's been very much welcomed by all our staff from all walks of a professional background, and we have had almost no reactions or side effects or any situations that require folks to think twice about receiving the vaccine. Let me assure everybody on the call that this vaccine is extremely safe. It was very thoughtfully developed, and the fact that it was developed over a short period of time does not mean that there were any shortcuts or any missteps or anything that was supposed to happen that didn't happen. It was just that happened done fast. I personally encouraged all the staff and continue to encourage the community, including my own family. I had a conversation with my elderly parents who are there in their 80s, and they can't wait until their turns come. And my daughter, who's expecting, asked me about the vaccine, and I encourage her to get the vaccine when her turn comes. So if that's an indication of how convinced I am as a scientist and as a physician of the safety and the importance of the vaccine, I don't know what else I could tell you.
Thank you so much. And next, I'd like to introduce also my good friend, Juliette Kaim, former Department of Homeland Security Assistant Secretary for Intergovernmental Affairs under President Barack Obama. And during her tenure, Juliette played a pivotal role in major operations, including the handling of the H1N1 pandemic, and organized major policy efforts in community resiliency. Juliette has been instrumental in helping us navigate the unprecedented challenges of the past 10 months. Thank you again for joining us this evening.
That's so sweet. Thank you so much, Congresswoman. And just, gosh, I am so sorry for everything that is happening, but so grateful for all of your work and leadership for all of us out there. And to my neighbors, because you are my Congresswoman as well, I wanted to say hello. So it's been quite a week, and I'm going to now shift gears because I also have been very involved with what has been happening with the domestic terror threat. And look at, I think, the news. And I'm going to put this in the national perspective just so you could get a sense of where Massachusetts is, but also what to expect with the Biden plan that's being announced at 7:15. I work with the teams down there about sort of what the thinking is, and then what they're seeing and what you may be hearing. I want to make it clear that an anecdote does not make a statistic. And I think for those of you who may be savvy on social media, or, what do they call it, doom scrolling. It is not that things are great, but it is far from being a disaster, as you just heard. Systems that have to get into place like this often take a while. The United States is a big place. But let me just give you one data point. On January 5th, the United States had only vaccinated 5 million people. By yesterday, it was 10 million. So that's the kind of exponential growth. So while you have the horrible exponential growth with the disease, we're starting to see the grease work in its way through a very, very complicated system. That system has actually 4 parts, and I thought it'd be helpful to just hear what those are. I mean, the first is obviously supply/demand. The goal is to get more vaccines on the market. You'll be hearing about Johnson & Johnson relatively soon. That's a single dose, which makes people who work in logistics very happy, and it doesn't require the cold storage, which means that more places will be able to deliver the vaccine. One of the challenges logistically is, of course, the cold storage reduces the number of places. So the first is demand, and then working with communities to make sure that we don't have too much vaccine hesitancy. On that front, we're starting to see some good numbers too. I'm not saying this is great. I just want, we have to be hopeful about something. Where even just 2 months ago, about 50% of Americans said that they were very skeptical of the vaccine. The numbers look very different now. Part of that has to do with, I think, the election of President Biden. Part of it has to do with when a vaccine exists. That feels very different to people than talking about it in theory. So right now we have 40% of the American population ready to take the vaccine like yesterday, and that I'm in that category, but I'm going to have to wait. The other 40%, and so for those of you who work with communities that might be more skeptical, the other 40% are not at no, they are at not first. In other words, their skepticism is I kind of want to watch a while. So that's a community that we can work with, right? Because that hesitancy is something that's our neighbors needing to know that you took it. That's, it's faith leaders and stakeholders and influencers, as the kids call it, getting out there. So that, so we may have a vaccine supply issue, but hopefully that can get cured relatively soon. The second is, of course, allocation. We're all in different allocation groups, and I think you're seeing some creativity on the local and state level to make that a little bit more flexible so that vaccine doesn't go to waste. But we also have to make it fair. So the more flexible it becomes, the less fair it may become. So one of the reasons why we have these stringent lines about Group A and Group A 1A and 2A and 3A is just because as a society we've made a decision that healthcare workers and then, essential workers and people over a certain age. So the third is distribution, and that's where that's what we call the last mile. That was really rough, I would say, in the first month. I think that is also getting better. You're starting to hear both of smaller places opening up and then the large facilities like Gillette, Disneyland, I heard, and other places. So we just need to throw everything at the wall, because once we get to larger allocation groupings, lots of people are going to show up. The system will not be perfect, but I think we're seeing the trajectory that someone like me looks for, which is the exponential growth. And then the fourth is essentially the kind of society we may live in and people may feel uncomfortable with, but we are going to have some verification system in the future. I don't know what that future looks like and what that verification is, but in terms of airline travel, you might see private businesses, concerts, movie theaters begin to have requirements for vaccination absent a extenuating circumstance. And I think that's what society looks like, to get out of this. So I'm just going to end with this. How to think about the next 6 months is as a split screen. The horror of the numbers that we are seeing, and they're going to get worse and inexcusable, as we know, but also new leadership that is going to mandate certain things. But we will hit 6,000, 7,000, 8,000 dead a day. There's just, unfortunately, I don't see any stopping that in the foreseeable future. On the other side, though, is hope, right? Is that this thing is starting to move. And what you're going to see in the Biden plan tonight is obviously focused on helping our communities and the financial stresses so many are under, but also what I would call a lot of basically a lot of gas in the tank. It's going to be a lot of resources to deliver to state and localities so that they can pay for increased capacity. You're not going to see a federal takeover of this. So I went on too long, but that's sort of the tectonic plates that we see going on. Not as bad as a lot of the news stories, certainly not where we want to be. So thank you.
Well, thank you, and we are so grateful to have both of you with us. We have gotten a lot of questions from constituents ahead of tonight's town hall, and so we're going to try and get to as many as we can, but I'll start with some that we hear most frequently. And Dr. Sayre, you've already touched on this a little bit, but we have been hearing a lot of concern about how quickly these vaccines were developed and approved. A matter of months when they typically take years. Could you explain the steps that Pfizer and Moderna would have to go through to get this authorization for emergency use, and how these are different from other vaccines we are familiar with, and why we can still be confident they are safe? And just to add a little bit more to that, if there are any differences between these two vaccines, and if people have a choice, should they be trying to get one versus the other?
Great questions, and let me see if I can sort them out. The science behind the two vaccines, let me start by saying the Pfizer and the Moderna vaccines are very, very similar. And they're based on very similar scientific background and basis. This science is pretty new science, but not completely novel. Science that was developed between 2008 and 2012 related to immune therapy and therapy related to mainly oncology and cancer, and how to go to the next phase of caring for cancer patients, particularly cancers that are very, very difficult, and we did not have treatments for them in the past. They are based on a messenger RNA, which is basically a piece of code that carry with it information to develop a certain protein. And to say it simply, it is the recipe, not the cake. So the messenger RNA basically has the recipe with it, not the cake. And it has the recipe to teach our body how to create the immune response, the defense, if and when we are exposed to the virus in the future. The messenger RNA is a small length of code covered with a protein. And that's the reason why it's so fragile, and it needs to be stored and transported very cold, because under normal environment and without being gently handled, it will break apart and it will not be very effective. And that's why those vaccines, when they're constituted and they're warmed and they're ready to be delivered, they're only good for a few hours. One slightly longer than the other one. Developing the vaccine was very methodical, very appropriate, went through all the steps that a normal process will take in years, but it was shortened over a short time. But all the steps were done in parallel versus in normal circumstances we do them in sequence. So we do the first step, then we evaluate, then we write papers on it, then we do the next step, then we get more funding and evaluate and write papers on it, scientific papers, then we do on and on and on. The funding for this, as we all know, was all put ahead. And the evaluations were happening in parallel as we were developing the actual code. This code has been tested by tens of thousands of people, humans, for efficacy and for safety. And therefore, we know, one, the process is safe and it is reliable. Two, the outcome is safe and is reliable, i.e. efficacious.
Mm-hmm.
And it is about 95, 97% protecting people who have been vaccinated by both doses 1 to 2 weeks after the second dose from getting COVID infected. So it is pretty effective, and the amount of side effects is very minimal, and it's mostly mild. The vast majority of side effects, if not the whole totality of side effect, is mostly mild, which is local pain, fever, muscle aches. All will go away after a few days. I feel personally very comfortable with the science after reading and investigating the science. I feel very comfortable in advocating for the vaccine with our own staff, our own communities, my own family, and I encourage everybody out there to trust that this vaccine will work and will protect us and our loved ones from getting the infection, from getting COVID, and hopefully eventually will protect the whole nation, because the alternative is not very pretty without the vaccine. If this continues, the only way we're going to get out of this is if enough people get the infection, and that's 80% of the population gets the infection. And if you do the math, 1 to 2% death, that's a couple of million people dying from this. That's not a pretty picture.
No. And, one of the questions that we have received is, for those who have an underlying condition or an allergy to other vaccines, is it safe for them to get this vaccine? Are there people who should not get it?
That's a great question. There is no contraindication to this from an allergies point of view. The requirement is that, particularly for people who have allergies, that they are observed for 15 to 30 minutes, particularly after the second dose. Usually, if you have any reaction, it's more likely that it's going to happen after the second dose. But the recommendation is that they are observed after both doses, each of the doses. If they're going to have a severe allergic reaction, it's going to happen pretty quickly. And for those folks that have a severe pre-existing condition or severe allergies to other vaccines, they should probably get vaccinated in a clinic or in a healthcare environment where an intervention can take place if they have a reaction. For the general public, the likelihood of any of that happening is almost zero.
And what do we know about how long immunity will last? Are we going to need an annual booster like we have now for a typical flu vaccine?
That's a great question. The answer is we don't know. And right now we're confident that we have that this vaccine will provide immunity to the virus as we know it today and all the variants that we know of today. As we all know, viruses mutate. And the reason we need another flu vaccine every year is because although we developed immunity for last year's virus, this year or next year's virus has changed. And it became a new entity to our body. And therefore, we need to prep the body with a vaccine for the new form or the form of the new virus. And that's why we need additional vaccinations for the flu. The question you need is of two-part. Will our immunity last? How long does our immunity last? And we don't know the answer to this. And the second piece is, will this virus mutate that will require a different vaccine or a slightly different vaccine downstream to prep ourselves for the new form of the virus? We don't know the answer to those two questions.
Well, thank you for all of that. And Juliet, I wanted to ask you, everyone is so grateful to see frontline medical workers, nurses, doctors, those working in nursing homes and assisted living getting vaccinated. And we know that there is hesitancy, and we need to address that. But many folks just want to know when they are going to be eligible. Can you walk us through why it's important to prioritize certain groups?
Yes.
And what can we expect going forward as more vaccines hopefully get approval?
Yes, so this is a great question. And I want to say there's no right answer. This is probably one of the most ethically, logistically, the hard issue comes up with allocation because the especially in a nation like ours that is suffering so badly, do you just want to stop the people from dying, and what category that is? Well, that seems obvious, but then you think, okay, but we got to get society moving again as well. So then we're gonna look to other pools. So basically, you're going to see a big compromise, but no one disagrees with. Number one is medical health workers. There's going to be debates about who falls into that. Don't get, as I said before, don't get hung up on hearing that 5 people got it. I mean, we're talking in magnitudes of millions at this stage. So that is your first category. The second category is critical. There's variations on that, but I'm going to just cut to the chase, which is critical or essential workers with over. I think the first grouping, Dr. Krause, is 75-year-olds. So you're going to do a combination of I want to stop bad things. I want to stop the death rate, which is essentially older people. Plus, I want to get society moving again. And it depends on which state, who you're defining in the essential worker pool. But it's people who satisfy the supply chain, satisfy critical infrastructure. I forgot to say something on the first round, on the first allocation, which is, of course, residents of long-term elderly care, because just what we saw was the virus just, basically killing large swaths of that population. Then so think of the vaccination program as a rolling recovery. And as we pick up speed, it's like a tidal wave, things will just move faster. And then we get to general population after some age distinction. So we're basically after critical infrastructure, it is then going to be age focus and then general population for 55 and under. And how states are going to do general population, we don't know yet. And the Biden team may have their next thoughts or new thoughts on that. So that's how it's going to look. What I'm looking at is how fast are new vaccines going to satisfy this growing demand, because we don't have the hesitancy that we worried about originally. We think Moderna and Pfizer will last us. It's about 100 million between the two of them. Will last through April. So the hope is you can get Johnson & Johnson online, although there has been some news reports that they're a little delayed. I don't want people to worry. No one's changing their trajectory much. But you'll hear about little gaps in timing. So that's how it's going to work. And you should keep basically notifications should be, the Congresswoman's office will certainly hear when new allocations are opening up and new places are opening up. So many of you may have been notified. And then your local healthcare facility or primary care physician or looking online. The Cambridge, I live in Cambridge. The Cambridge nightly COVID report is phenomenal. I am sure other towns in the district are doing it as well, and it gives you a sense of how things are going there as well. So the local news will give you a sense of that.
And how do you see the vaccine being distributed when it is available to the general population? I know we are watching Gillette open up as a mass distribution site. Do you see that we will have a combination of at your doctor's office, at a CVS or Walgreens, and some of these bigger sites? Is that what you anticipate?
Mm-hmm. Yes, I do. So the big site and some of them are drive-through. So, and I'll tell you something, because I look at this nationally. The states you would least expect to be great are sort of doing well, which is frustrating because they also were horrible on masking and stuff. But Arizona seems to be doing well, and some other states. I'm glad for them. We need to be doing better. Massachusetts is about in the middle, which we shouldn't be, just given who we are and the resources we have. So there will be the bigger sites, Red Sox, Gillette, some of the big fall festivals, and our places, the Big E, will open up. But then remember, with the new vaccines that may not require the specialized storage, you'll start to see a much more nimble vaccination process, and I think eventually getting the private sector and other entities involved.
I agree. I think it's going to be all hands on deck, and I believe that we need to roll out the process a little faster and make sure to get the vaccine in the hands of the professionals so we can deliver it to the general public.
And when we are able to get people their vaccines, tell us a little bit about how important is it? Do people need to continue to adhere to the recommendations about social distancing and wearing masks? Or once you have the vaccine, can you no longer carry the virus?
I think for the foreseeable future, the right thing to do is to maintain the etiquettes that we learned over the last year of hand sanitizing and social distancing and wearing masks, again, for the foreseeable future. I truly believe that eventually things will improve and will be in a different place. Remember, you don't know who the next person is, and you don't know how sick they are or not. And, the fact that somebody is vaccinated, they're not 100% immune. They are 95, 96% immune. It is important, at least for the foreseeable future, until we have enough spread of the vaccine and data and science behind it that's appropriately analyzed by public health officials, that this will continue. The other piece also, the etiquettes of the social distancing and washing hands is very important, because there's a whole lot of other diseases out there than COVID that we will benefit from continue doing these things anyways.
That is a good point. I have noticed that I have not had a single cold this
season
because of the masking and all the precautions. Speaking of things that are highly contagious, like this virus, so is disinformation. And I wondered if you can tell us, are there some common false claims that are being made that we should be wary of and try to combat?
Yes, I monitor go ahead.
Sorry, go ahead, Juliette. I was going to speak about the science and, et cetera.
Yeah, go. You do that, and I'll talk about the distribution. You go first.
Okay. So the false claim, people, and I've heard rumors which are completely false, that the virus will go into somebody's DNA and they will change their DNA makeup. That is absolutely false. The messenger RNA does not get into the nucleus, which is the part of the cell where the DNA is stored. The whole process happens outside the nucleus. It's called the area called cytoplasm, where this code is processed and develops a protein, and the protein will help our own body develop the appropriate immune response if and when the virus, if we're exposed to the virus. So there is no effect on the DNA. The messenger RNA does not get into the area where the DNA is in the body. It does not change the way that the cells behave, and it is pretty much safe. It is basically, as I said before, it is the recipe, not the cake. And it is the recipe that teaches our body how to respond when we are exposed to the virus. Juliet?
Yes, it's exactly right. So this disinformation is coming from foreign enemies who are catering to the divisions in our own society about vaccination, the divisions that we have generally, and they go both to the science and then to the information about the about whether you're vaccinated or not. So it's sort of a health security information. What I say is, however you get your news, if you feel it's reliable, stick with that news. I'll say Moderna gets all the hometown love, but I'm also going to give hometown love to Boston Globe's STAT News, STAT News. It's free. It's only online, though. The Boston Globe a couple years ago created its own health bio division, and now it is a national go-to source. And if you get a chance, if you're able to get online, that's where I get all my information. It's sort of the Economist for the pandemic. The other place to go for monitoring vaccination, the reality versus the not reality. The CDC is fine, but actually Bloomberg, if you look at Bloomberg online, again, none of this is, it moves so fast that it's sort of online charting. It has a daily tracker, which I find very, very reliable.
Great. Well, I think we have a few minutes for some questions from the queue. We have Gus from Framingham who has a question. Gus, you should be
Hey, Hi, Congresswoman. Gus from Framingham. I wanted to thank you for... Oh, hello?
I just was saying hello, Gus. Thanks for joining us.
Oh, hi, Congresswoman. Thank you for holding this call. First, I wanted to thank you and your staff for helping with the casework issue this fall. They were super responsive and got back to me and solved the issue within a matter of days. So thank you for that.
Wonderful.
I had my first dose of the vaccine last week, and it tracks right with what the doctor said. I didn't have any bad side effects or anything. So just have to wait for the next dose. But my question is, and they just talked about misinformation. I think one of the biggest issues I've had, especially with some of the women that I supervise, is they're concerned about its impacts on pregnancy or if they were pregnant. And so I know the doctor mentioned that his daughter is pregnant and he recommended that she get it. So if he could expand on why he feels comfortable with that or any disinformation that he's seeing with that, so that when we're talking to people who bring up that specific concern, we have some better answers.
Absolutely. And thank you for asking the question. We don't have enough science to definitively give an answer one way or another. But I can tell you, getting the COVID vaccine, we know for somebody that's pregnant is not very good for the mother or the fetus. We know that because we've had pregnant women get COVID vaccine, and the potential complications there are high. We also know that some of the volunteers that got tested with both Moderna and Pfizer vaccine got pregnant. They were not pregnant when they got the vaccine, but got pregnant at some point. And a few of them got pregnant actually between the first and the second dose. And it was proven to be safe. So with this little anecdotic information, when I personally weigh the pros and cons, and there is a lot of data out there, I would encourage people to go online and get information. And the CDC has a very good review regarding expecting mothers and COVID, and also the vaccine. There is no true 100% recommendation right now to say they should be vaccinated or not, and the recommendation is to speak with your obstetrician. But reviewing the data and speaking with our staff, and many of them are well-known obstetricians. A couple of them were just named top obstetricians by the Boston Magazine in the last week or two. The recommendation, and I researched it not only for our staff in the community, but for my own family, is to get vaccinated. I hope that answers your question.
Great. Next, we have Elaine from Waltham. Elaine, you should be unmuted.
Hi. My question is, with the new, more shelf-stable vaccines that are coming out, like from Johnson & Johnson, are they as effective as the vaccines coming out from Moderna?
That's a great question. We anticipate that vaccine is as effective. Otherwise, it's not going to get the approval to be given to the public. It needs to be, one, safe, and two, effective. Still reviewing the data on this and the science, and I'm sure over the next month or two there'll be a lot more data and science coming out. But so far, it is very promising.
Great. Next up, we have Serafino on the line. Serafino, you should be unmuted.
Hey.
Good evening.
Good evening, sir.
Serafino?
Yes.
Yes, you can go ahead with your question. Thanks for calling.
I'm sorry. I'm confused. I have an autoimmune disease, and I've had it for, I'd probably say about 30 years now, which was expected. But I've been dealing with the CDC a lot and trying to take different medications, trying all different types of chemotherapy to control it, to control my immune system, because my immune system is out of control. So are you saying that it's okay for people with serious autoimmune disorders or like lupus and all that kind of stuff? Mine happens to be myositis. It's okay for them to take the vaccine?
That's a great question. I can tell you so far the indication and the science and the evidence is that it is safe, but I would encourage you to speak with your own immunologist who really knows your situation specifically and can guide you specifically regarding what you need to do with your case, with your situation. But so far, the data and the evidence is that it is safe even for folks that have autoimmune disease.
Okay, thank you so much.
You're welcome.
Thank you. Next up, Charles from Sudbury has a question. Charles, you're unmuted.
Thank you. I appreciate the opportunity of this evening. It's terrific. President-elect Biden has advocated one dose without holding back that second dose that people are been waiting for. I guess they're looking to. And the question is the efficacy of that process. Will, if someone has to wait 3 months, I don't know what the time frame, of course, would be, 3 months purely as an example, will the efficacy be the same? Will we now be at 95%? Or will that booster shot not really have the same benefit?
That's a great question. And in both Pfizer and Moderna vaccine, the first dose alone will give people somewhere between 80 and 85% immunity. And the second dose will bring that up to 95+%. So 85% is pretty good, but it's not ideal. And, the question is, do you give more people one dose, or hopefully we have enough vaccine to give everybody 2 doses and get them to 95+%. And this goes back to Juliet's initial introduction, production and availability and et cetera. On the other hand, also it is important. We don't know how many people are going to step up and get the vaccine too. I hope everybody does.
Yeah, I do too. I really, I can't, I cannot describe enough from the non-medical perspective as I said, this rolling recovery, how different things will be, not just economically, but our frustration levels, our sense of unease, everything that we're feeling as we begin to open up. I want to say one thing about the one dose debate. A lot of you may have followed, the single dosage versus debate earlier, and I want to clarify because there was some confusion. I think for a non-medical person, I was confused, and I consider myself an expert, so I got some clarity. There was a proposal on the table that the FDA shot down. Biden may try it again, which was to basically only do the one shot and just get as many people, 65 or 70% immunized, because we knew the first shot went very far. That's not an illegitimate proposal because we're all desperate to get some immunity, but it wasn't what the FDA had approved. So that was pretty controversial, and I think split a lot of the medical community. What you're hearing Biden say is different. The Biden proposal is if we can make consistent the supply chain so that we know that another 20 doses are coming 1 week from now, why would we hold 10 doses, half of 20 doses back if we know another 20 are coming? So those are differences. So the Biden folks are not proposing single dose for a 2-dose tested vaccine.
And I think that's a very important clarity in here. The approval is for 2 doses, and the testing for efficacy is for 2 doses. And I agree, if the supply chain is reliable, that's the direction we need to go. I agree.
Mm-hmm.
I thought I heard that it was 50% effective for the first dose, not 75%.
No, it is actually over 80%.
For both?
Of the first shot? Yeah.
For the first shot, yes.
And that's true for both Pfizer and Moderna?
For both, yes.
Wow, okay. Well, that's good news.
Yes.
Thank you so much, Charles. I think we have time for just one more question from the queue, and we have Marilyn from Melrose.
Hi, thank you so much. I have an underlying condition, and I'm over 75. I just want to know, do I need some sort of proof of what the condition is? I have some scarring in my lungs, so that's what I was wondering.
Yeah, it is safe in your situation, and particularly, in your age group, it is very important that you get vaccinated.
I'm not worried about the vaccine because I know some of the people who developed it, but I am concerned about my ability to receive the vaccine when it's offered.
You mean as your priority in the list?
Yes.
Yeah. You are probably going to be next on the priority in Massachusetts, so you're not far from getting the vaccine.
But do I need like a CT scan, or is my word good enough?
You do not need a CT scan.
Okay. Thank you.
So people will be able to self-verify that they have that they meet the criteria for that round?
Yes, and also remember that people have their own doctors too, and you should check back with your doctor. But we are moving towards an environment of trust, and we need to continue doing that.
Great. Well, I know that we have a lot more questions that we haven't been able to get to. If you did have a question that you wanted to ask tonight, please stay on the line, and you'll be able to leave a message, and our staff will get back to you and connect you with those answers as quickly as possible. And I'll turn it back over to Congresswoman Clark to wrap up.
Well, thank you, Kelsey, and especially thanks to our 2 special guests and to everyone who joined us this evening. I am so grateful to our experts for taking the time and help us answer questions. I know I feel better after this conversation, and we appreciate how hard you have been working on this throughout this crisis, and really appreciate not only your perspectives, but your critical work that you've been doing. So to everyone on the call from our district and in Massachusetts, please know that my staff and I are available to help you access what you need and the information that you need to keep safe and healthy. I'm going to continue working in Washington so that we can deliver the support to your family and to our communities. Thank you again for joining us, and we look forward to hearing from you soon.